Upon completion of this training, you will be able to define bloodborne pathogens, list common types of bloodborne pathogens, describe how bloodborne pathogens are transmitted from one person to another, describe techniques for transmission prevention, and understand what you should do if exposed to a bloodborne pathogen. Bloodborne pathogens are microorganisms, such as viruses or bacteria, that if present in blood, can cause disease or illnesses in humans. These pathogens can be transmitted from an infected person to a healthy person by contact with infected blood or other bodily fluids. Additionally, a person can be infected by bloodborne pathogens through the contact of other potentially infectious materials, or OPIMs. There are a number of relatively simple actions which can be taken to drastically reduce the chance of exposure to bloodborne pathogens. Depending on the type of work being done, workplace practices and methods can be modified to minimize the chance of exposure. An infection can be spread if bodily fluids containing pathogens from one person to another make contact with another person's broken skin. Blood, blood products, and blood-contaminated objects are the most likely carriers of bloodborne pathogens. You may encounter blood in the workplace if your coworker is bleeding or has broken skin. Blood could also be on a sharp object that has cut someone or on a work surface a coworker used during an injury. It is less likely, but still possible, for a bloodborne pathogen to be transmitted through other potentially infectious materials, or OPIMs. Chances are you probably won't encounter OPIMs on the job, as they include fluids surrounding the brain, spine, heart, and lungs, amniotic fluid, sperm, and vaginal secretions. You and your coworkers work hard each day on the job, so you may encounter more common bodily secretions such as sweat, saliva, nasal secretions, urine, and possibly vomit. The good news is these secretions are least likely to carry pathogens. However, if these body fluids contain blood, the risk of transmission of a bloodborne pathogen increases. Proper personal protective equipment is an important component in preventing the transfer of bloodborne pathogens from an infected person to a healthy person. There are a number of bloodborne pathogens, but the most common blood-related illnesses are hepatitis B or HBV, hepatitis C or HCV, human immunodeficiency virus or HIV, which leads to acquired immunodeficiency syndrome known commonly as AIDS. Hepatitis B is a liver disease caused by the hepatitis B virus. The infection can be acute or short-term. It can also be chronic. Short-term symptoms can vary between none at all to vomiting, yellowish skin, constantly fatigued, dark urine, and abdominal pain. Most victims recover from an exposure. However, approximately 10% of adults exposed to the virus develop chronic, lifelong hepatitis. Most chronic sufferers have few ongoing symptoms, but over a period of years are at a high risk of cirrhosis of the liver or liver cancer, both of which are life-threatening conditions. There is a vaccine to prevent HBV, but there is no cure. For chronic HBV sufferers, antiviral medication can sometimes slow the progression of the disease. If there is a reasonable chance that a worker may come into contact with bloodborne pathogens while performing normal job tasks, an employer must cover the cost of the hepatitis B vaccination if requested by an employee. Hepatitis C is another liver disease caused by the hepatitis C virus. Initial symptoms are usually non-existent or mild. If present, the symptoms include fatigue, stomach issues, muscle or joint pain, and weight loss. If the virus persists or becomes chronic, the virus can severely affect 75 to 85% of those infected. Most chronic sufferers have few symptoms initially, or for many subsequent years. However, those infected are at a high risk decades later to develop cirrhosis, liver disease, or liver cancer. Currently, there is no vaccine to prevent HCV. There is a treatment that is over 95% effective in eliminating the virus, but it is very expensive. Human immunodeficiency virus, or HIV, if left untreated, can lead to acquired immunodeficiency syndrome, or AIDS. HIV may cause flu-like symptoms, or perhaps no symptoms at all initially. HIV attacks and weakens the immune system, making a victim over a period of months or years more likely to suffer from a wide range of infections and infection-related cancers. With a weakened immune system, these infections can be life-threatening. It is at this point an individual is said to have AIDS. Currently, there is no completely successful vaccines for HIV and no absolute cure. There is a program of drugs that can improve the quality and length of life for someone with HIV or AIDS. Bloodborne pathogens live and exist in the blood of an infected person. These pathogens may be present in other bodily fluids, such as semen, vaginal fluids, or any other body fluids that may contain blood. In order for these pathogens to present a danger to you, they must somehow transfer into your bloodstream. Infection can be transmitted by such activities as deliberate sharing of a syringed needle, as is common in illicit drug use. A needle contaminated by being in an infected person's blood provides a direct route of transmission if it is reused by an uninfected person. A needle stick, or the unintentional action of being poked by a needle or sharp object that contains an infected person's blood or bodily fluids. This has the same effect as the deliberate sharing of a contaminated needle. Sexual contact or intimate touching of an infected person. Small cuts or abrasions in the skin of an infected person may allow the transfer of bodily fluids of an infected person to a person not infected. Contact between infected bodily fluids and mucous membranes, such as in the eyes, nose, and mouth. Contact between infected bodily fluids and skin that has cuts, scrapes, or open sores. Due to the fact that there needs to be direct contact of bodily fluids for the transfer of an infection, the chances of being infected during normal activities in the workplace are very low. Casual contact, such as handshaking or hugging, sharing work equipment, or restrooms, will not transmit bloodborne pathogens. However, you can become infected if you come into contact with blood or bodily fluids while helping someone who is injured. Because people can be infected for months or even years and show no symptoms, always treat blood and bodily fluids as if infectious and take extreme precautions coming into contact with them. A sharps container is a place where individuals can deposit needles and other sharp objects that could puncture or cut the skin. These containers are often found in public bathrooms, and you should avoid any contact with these containers. Needles are often placed in these containers, and there is a high probability these needles contain small traces of blood. Needle sticks are most common in the medical profession. However, there is a growing risk of needle sticks in any workplace due to people with diabetes, allergies, and other conditions where people use a syringe and discard these syringes in trash cans and bag trash. There are several preventative measures which can be taken to stop the transmission of bloodborne pathogens. Some actions are required by businesses and companies. Other measures are dependent upon you. Preventative measures can be classified in three general ways: engineering controls or physical design, administrative controls or behavioral guidelines, and personal protective equipment. We will cover each of these techniques in this training. Engineering controls are physical or design changes made to equipment or the workplace. These controls protect employees by reducing or preventing any exposure to bloodborne pathogens. Well-implemented engineering controls are the best solution for preventing exposure, because they are generally more effective and more reliable than other types of controls. The engineering controls at a workplace depend to a great degree on the type of work activities taking place. One example of an engineering control to prevent the spread of bloodborne pathogens would be the use of sealed containers to prevent employees from handling trash bags. Administrative controls are behavior-based protective measures. These are the guidelines, training, and workplace rules at a workplace that reduces the exposure to bloodborne pathogens. Through these approaches, much like this training, employees are more familiar with the dangers associated with bloodborne pathogens and steps they can take to minimize or eliminate exposure. All employees responsible for the cleaning and disposing of potentially contaminated materials should be identified, trained, and authorized by their organization. Personal protective equipment is perhaps the most effective precaution an employee can take to remain safe when a condition exists involving bloodborne pathogens, placing a protective barrier between you and the potentially hazardous conditions, if they exist. Using PPE can prevent the transmission of pathogens by keeping them outside of your body. Always wear disposable gloves when dealing with bloodborne pathogens or bodily fluids. If there is any chance of splashing or splattering of blood or body fluids, wear protective eyewear, goggles, or a full-face shield. If dealing with large quantities of fluids, use a disposable apron or smock to protect yourself and your clothes from contamination. Avoid unprotected mouth-to-mouth resuscitation. New CPR guidelines have eliminated the practice of mouth-to-mouth resuscitation to prevent accidental exposure. Finally, when removing protective equipment, such as gloves, avoid touching your equipment with unprotected hands. Discard all contaminated PPE, materials, and clothing in a designated biohazard bag. In a situation involving unprotected exposure to blood or potentially infected materials, you should take the following steps. Remain calm. Remove contaminated clothing as soon as possible and place these items in a biohazard bag. Wash all exposed skin with a non-abrasive soap and warm water. Flush exposed mucous membranes with water for at least 15 minutes. Report the incident to your manager, supervisor, or human resources immediately. Contact a doctor within 24 hours of exposure for testing. It is very important that prior to going to a doctor for testing, you make arrangements through the Human Resources Department for the proper paperwork and authorization. As you probably have noticed, we have not specifically addressed the cleanup procedures for bloodborne pathogens or bodily fluids. That is because only those individuals that have been trained and equipped on the specific steps of cleaning up these hazards are authorized to conduct this process. If you have a situation that requires the cleanup of hazardous body fluids or blood, coordinate this with the appropriate individuals by notifying your manager or supervisor. And finally, if it is wet, icky, or sticky, leave it alone. If you keep this saying in mind, you can prevent many exposures to hazardous situations